Here's part 3 of my interview with Dr. Thorpe, wrapping up our conversation about total knee replacement. And if you are ready, we'll cover point number 7, what happens to the kneecap during total knee replacement. Point number 8, is there risk in postponing a total knee replacement? And point number 9, Dr. Thorpe's best advice for being ready for your total knee replacement.
Have your legs be as strong as possible. And the other thing is the weight, having your weight as low as possible. One thing I would quote my patients is that the stress between your kneecap and your femur is 4 times your body weight when you're climbing stairs or squatting. So if you weigh 200, there's 800 pounds going on in there when you climb stairs, and so every pound you lose, you take 4 pounds out of your knee joint.
Now, I didn't know that statistic. That's amazing. Yeah, so if you're carrying an extra 50 pounds, that's an extra 200 pounds of pressure, right?
Yeah, in between your kneecap
Between the kneecap and the femur.
Which, if you're already arthritic there, that's a lot.
Yeah.
Yeah.
That so when you're doing a knee replacement, the underside of the kneecap, that gets resurfaced every time or sometimes?
Most people do. There's a certain group of surgeons out there that don't resurface the patella, the kneecap, regularly. Most studies have shown that if you replace the kneecap, it's better pain relief, but it's not always. And so some people just replace the end of the femur and the top of the tibia and don't touch the patella.
Yeah.
I always replace the patella. Most of the time it's got some wear on it, and you certainly don't want to do the femur and the tibia resurfacing and then come back 3 years later and have to open the knee again just to do the patella. No. So, I just did them all.
If you have been through knee replacement surgery, you know how much you don't want to have another surgery.
Yeah.
So doing it all at once makes sense.
To me it does, yes.
It's quite a bit to recover from. And I have people tell me all the time they didn't know it was going to be so painful. It does get better. I mean, with my replaced knees, I have no pain, and I have so much more freedom in what I can do. I've added back hiking to the things that I can do, which is fantastic. There's all sorts of trails that I've never been on around Bellingham and Washington State because of my knees. So,
see, if we told people everything, we wouldn't have any business.
Yeah, right.
No, I do try to get them ready for that, but we have so many better techniques now for relief of pain than we had, even 5-10 years ago. So,
if some people are just so averse to surgery, and I was one of those. I really did not want to give up on my knee. I wanted to preserve it as long as I could. I was afraid that my results wouldn't be better, because there is always that possibility that somehow it doesn't go as well as you hope. And so I wanted to put it off as long as possible. Is there risk to the patient by putting off the knee replacement as long as they can?
Oh, a little bit. The things I would say is you don't want to wait until you're decrepit. You don't want to wait until you're so sedentary that you're weak, you've gained a lot of weight, you've lost your balance and proprioception. You want to be a good specimen,
Yes.
And so, you don't want to wait, and then all of a sudden you're 85 and you don't have a lot of reserve and the operation is going to be really tough on you. Go ahead and have it at 75 or 80 if you're already a candidate. My Norwegian relatives in Minnesota lived 20 miles from the Mayo Clinic, and they let themselves, my grandparents, become basically sedentary, gained weight, and they never went and had their knee replaced. And this is when I was a kid, so I didn't realize that I couldn't have advised them, right?
Right.
But darn it, if they had gone and gotten their knees replaced, they might have lived even longer than 80 and 89.
Right.
So.
And they certainly would have had a better quality of life.
Better quality of life, yeah.
Because then they can move around and do the things that you want to do.
Better for your diabetes, better for, everything, asthma, whatever.
Right.
So, so better to do it not super late, but not super early. And your doctor can advise you, and then, of course, you'll know symptom-wise when you're ready to give up.
Yeah, I mean, I knew, now that it's time. I knew that it was time, and I am so very glad that I did do it. I think one of the important things is getting as strong as you can before a total knee replacement surgery. I always looked at it like it was an athletic event. So I'm training for this thing that's going to happen on this day. And by getting stronger, as strong as you can, protecting whatever mobility that you have by doing the things that feel good, that aren't going to do more damage to your knee, will put you in a better position to have a faster, easier recovery. Recovery is never easy, but
No.
if you go in strong, you come out a little less strong. If you go in weak, then you're going to come in at a way lower starting point for your recovery, and that makes it all the harder. The thing I think that I wanted to express was that total knee replacement is not all of the solution. Having the body parts is a big part of having a working, functioning knee, but your own strength will make the difference between how well that knee is going to work ultimately. So it's not just the mechanics, having the joint replaced, but also taking the time and effort to do the strength training that you can to get stronger.
Yeah. And I would say you were in the top 1% of people getting ready for this athletic event. You did a great job.
Oh, thank you.
Yeah.
And and that's why I'm here. I had so many knee issues all of my life. I was born with a rare condition called discoid meniscus, having too much cartilage in my knees, which you'd think would be a good thing, but ultimately was not. So I want to help you avoid some of the pitfalls that I had along the way and have success if you need to have a total knee replacement. Our next interview with Dr. Thorpe is going to be talking about what it actually looks like, the parts involved in a total knee replacement. So I hope you'll tune in for that. Last question for you, Dr. Thorpe. What is the most important advice that you could offer a patient about total knee replacement?
Well, a lot of what we covered already, I guess. Just be in the best condition you can be going in, both medically and your medical conditions, and then, as Robin mentioned, the having your strength as great as possible, mainly through straight leg raises, where you just lift your leg up and work your quads without moving your knee. That's a great way to do it. And having modified your activities beforehand, so that you're not just painful every day. So switch from and jumping and basketball and all that kind of stuff. That's fun, but painful, as I know. And move towards biking and rowing and swimming. And maximize your non-operative care, basically. Don't just say, oh, I've got an x-ray that's bone on bone, and jump in and have a knee replacement.
Right.
Most orthopedic surgeons wouldn't do that for you anyway. So maximize your non-operative care, the meds we talked about, and all the physical things, and then find a good surgeon and think about the aftercare. You're going to need a coach, a person that's going to care for you, and preferably do it around your own home, hometown, if that's available to do that, rather than. I'm not liking the medical tourism thing. People would go off to Mexico and have a knee replacement, and then they come back and have issues, infection, or it's loose, and we'd have to deal with it. And we're going, why did you do that? We could have done a great job right here.
Right.
So those are important points.
Okay. Well, thank you so much for sharing this time with me and all of the people watching. I appreciate it so much, and I hope that you like this too and will subscribe to the Healthy Knees for You YouTube channel. Stay tuned for our next interview, and I hope I'll see you then. Take care.